All right, so get this. You have these tiny filters in your kidneys, right? And they're called nephrons.
Mm-hmm.
And they're working right now to filter your blood. Wild, huh?
It is pretty amazing.
We are diving deep, deep, deep into glomerular filtration today.
Ooh.
And to guide us on this journey,
Mm-hmm.
we're using Dr. Rasha Eldeeb's physiology handout.
Oh, nice.
It's like having a personal tutor, breaking it all down.
Yeah, absolutely. Whether someone's listening to this for class or just, general interest in the human body, hopefully this deep dive will help them understand this really critical process of glomerular filtration.
So can we just start by picturing these nephrons as super efficient sieves,
Yeah.
separating the good stuff from the waste in our blood?
Yeah, that's a great analogy. Glomerular filtration is actually the first step in the process of urine formation.
Wow.
And it's happening constantly in those millions of nephrons that you have in each kidney. And it's a passive process.
Millions.
Millions, yeah. So it doesn't require energy from your body. It actually relies on just this pressure difference to push the fluid through that filter.
Millions of these sieves.
Yeah.
Okay, so if they're filtering constantly, how much blood are we talking about?
Right.
Is it a trickle? Is it a stream?
Think about a serious kitchen faucet on full blast.
Okay.
We're talking about 125 milliliters of blood every minute.
Every minute.
Every minute.
Wow.
And that's from both kidneys combined.
That's a lot.
Yeah. Pretty impressive for such tiny structures, right?
Yeah. Okay, so 125 milliliters a minute. These microscopic sieves are working overtime.
Mm-hmm.
So they must be incredibly selective, letting through the, water and all the good stuff, but keeping out things that are just too big or maybe even harmful.
Absolutely, yeah. The glomerular membrane, so that's the actual filter. It is a marvel of biological engineering. So
Yeah.
it's super permeable to water and small molecules. Things like electrolytes, amino acids, waste products. But it has this amazing ability to reject larger molecules, especially proteins.
So it's not just about size. What's the secret? Is there a bouncer at the membrane, checking IDs?
Well, sort of. Think of it this way. The membrane has these tiny pores, and these pores are lined with negatively charged proteins called sialoproteins. Sialoproteins.
Okay.
And they act like guards, right? So they repel any molecules that also carry a negative charge, even if they're small enough to technically fit through the pore. So it's like having a VIP list.
I like that.
Right. Only those with the right credentials get in.
Okay, so is that why albumin, which is a protein in our blood, doesn't sneak through?
Yeah.
I mean, it's smaller than the pore size, right?
That's right. Albumin has a negative charge, so those sialoproteins on the membrane are like, nope, you're not coming in.
Oh, I like that.
Right. It's really, an example of even at the microscopic level, our body has these really intricate systems for maintaining balance.
It's fascinating. Okay, now I'm picturing all this talk about filtering. I'm like, okay, so what is actually in stuff that gets through this filtrate, as we call it?
The filtrate, right. It's a pretty diverse mix.
Yeah.
But it's, mainly water, of course. And then you have electrolytes, so like sodium, potassium, chloride,
Okay.
along with essential nutrients like glucose and amino acids. And of course, there's the waste that needs to be eliminated, like urea and creatinine.
Okay, so it sounds like the recipe for urine, but I'm guessing it's not that simple.
You're right. What we've got at this point is just the primary urine. It's the initial filtrate.
Right.
And it still has a long way to go before it becomes, the final product that our body excretes.
Oh.
It goes through a lot more fine tuning as it travels through the tubules of the nephron.
Okay, so it's not a one-way street. We've got the filtering going on, but then there's more happening in the tubules.
Right. And to understand what happens next, we really need to talk about the forces at play during this whole filtration process.
Forces at play.
Yeah.
Okay, I'm picturing a tug of war.
Yeah.
Happening inside my kidneys right now.
You're not far off.
Okay.
So on one side of the rope, you have what's called the glomerular capillary pressure.
Okay.
And think of that as the main pushing force, trying to squeeze that fluid out of the capillaries and into Bowman's capsule. That's where the filtrate begins its journey.
Bowman's capsule.
Bowman's capsule, yeah. And that pressure is about 60 millimeters of mercury.
60.
60.
That's a lot of pressure.
It is for such a tiny space. But remember, there's another side to this tug of war. So opposing the filtration are two other forces. So the pressure inside Bowman's capsule, that's pushing back against the flow. And then there's what's called the oncotic pressure of those plasma proteins that are trying to hold on to the fluid within the capillaries.
So it's like team filtration versus team hold the fluid.
Exactly. Yeah, exactly. So the Bowman's capsule pressure is about 18 millimeters of mercury, and then the oncotic pressure is around 32 millimeters of mercury. So you add those together, that's 50 millimeters of mercury pushing back against that initial 60.
Oh, okay. So what happens? Who wins?
Well, after all that pushing and pulling, the net filtration pressure ends up being about 10 millimeters of mercury.
10. So like all that just to get to 10.
Right. But that tiny, tiny difference, that's just enough to keep the filtration going at a healthy rate.
Wow. It's incredible that such a small pressure difference can be responsible for, such a vital process.
Uh-huh.
But it seems like there's a lot of balance required for this whole system to work properly.
Yeah, you're absolutely right. And that actually brings us to one of the most important concepts in renal physiology, and that is the glomerular filtration rate, or GFR for short.
GFR. Okay. What does that mean, and why is it so important?
So GFR is essentially a measure of how much blood is being filtered by all those nephrons every minute.
Mm-hmm.
Remember that magic number of 125 milliliters per minute?
Right.
So that's a typical GFR for a healthy adult. And keeping that rate within a certain range, that's absolutely critical for maintaining the body's overall balance.
So GFR is kind of like a vital sign for our kidneys.
You could say that, yeah. If it's too low, then waste products start building up in the blood.
Oh, no.
Right, like an overflowing garbage can. But if it's too high, then we start losing essential things like water and electrolytes.
Okay, so neither of those scenarios sound good.
No, neither one's good.
So how does it make sure that the GFR stays, not too high, not too low in that Goldilocks zone?
Well, that's where things get really interesting. So our bodies have this incredible ability to auto-regulate GFR.
Okay.
So it's constantly making adjustments to keep things running smoothly.
So our kidneys have like a built-in thermostat for GFR.
That's a good way to put it.
Okay.
So one of the main ways this happens is through changes in blood flow to the kidneys.
Okay.
So for example, if our blood pressure drops, maybe from dehydration,
Okay.
then those afferent arterioles, so those are the tiny blood vessels that lead into the glomerulus, they're going to dilate. So they widen, right?
Okay.
And that lets more blood into the glomerulus.
So it's like opening up the faucet to keep that filtration going.
Precisely.
Okay.
And conversely, if our blood pressure rises, those same arterioles can constrict. So they narrow, right?
Okay.
And that reduces blood flow, and it prevents that GFR from going through the roof.
So it's like a plumbing system,
Yeah.
Constantly adjusting the flow rate. It's amazing how our bodies do this without us even thinking about it.
Yeah, it really is. But wait, there's another layer of control at play here, and it's called tubuloglomerular feedback.
Tubuloglomerular feedback.
Tubuloglomerular feedback, yeah.
Okay, that sounds complicated. Break it down for me.
So think of it this way. The tubules, those winding parts of the nephron, they're not just passively letting the filtrate flow through. They actually communicate with the glomerulus.
What?
Yeah, they send signals to adjust that filtration rate.
Okay, hold on. So they're like having a conversation.
Exactly, like a feedback loop, right?
Yeah,
constantly monitoring and fine-tuning the process.
Wow. Okay. So the tubules can sense like changes in the flow and the makeup of the filtrate, and if things are moving too fast or too slow, they'll signal the glomerulus to adjust the filtration rate.
Exactly, yeah.
Wow. Okay. So it's another layer of control to make sure that GFR stays within that healthy range.
Right.
Okay, so our kidneys are like a finely tuned orchestra.
Mm-hmm.
With all these different parts working together in perfect harmony.
Absolutely. And speaking of fine-tuning, I'm curious, have you ever wondered how doctors actually measure GFR? In a clinical setting, how do they know if your kidneys are doing their job efficiently?
Now that you mention it, yeah, that's a great question. It's not like they can stick a tiny ruler inside our kidneys and check the filtration rate.
Right. It's a little more complicated than that. But thankfully, there are some really clever ways to measure GFR indirectly. And they use a concept called plasma clearance. So essentially what it involves is tracking how quickly a specific substance is cleared from the blood by the kidneys.
Plasma clearance.
Yeah, so imagine we have a substance that's easily filtered by the glomerulus,
Uh-huh.
but it's not reabsorbed or secreted by the tubules.
Okay.
So it's like a tiny tracer following the filtration pathway. And by measuring how much of this tracer ends up in the urine compared to the blood,
Okay.
we can get a good idea of how well those kidneys are filtering.
So it's like adding dye to a river and seeing how much gets carried downstream.
Exactly.
Okay.
And the substance that fits this bill perfectly is called inulin. Now, it's not something that we naturally have in our bodies,
Okay.
but doctors can inject it, and then they track its concentration in both the blood and urine.
Okay, so inulin is like the secret agent for GFR measurement.
Yeah, you could say that. But, using inulin does require intravenous injections and multiple blood and urine samples, and that can be a bit cumbersome in a clinical setting.
Yeah, I can imagine.
So in practice, doctors often use a more readily available substance, and that's called creatinine, to estimate GFR.
Creatinine, isn't that a waste product from our muscles?
Yeah, you're right.
I think I've heard of that.
Yeah, so creatinine is a natural byproduct of muscle metabolism. And it's constantly being produced and filtered by our kidneys. So to measure GFR using creatinine, all we need is a simple blood test. No injections required.
Okay, so it's a lot easier way to assess kidney function.
Exactly. But it's important to note that creatinine isn't a perfect substitute for inulin. So a small amount of creatinine can actually be secreted by the tubules, and so it can slightly overestimate the true GFR.
Ah, so there are some limitations there.
Right.
But it still seems like a pretty good way to get a quick snapshot of how well those kidneys are functioning.
Absolutely, yeah.
Yeah.
And while GFR is incredibly important, it's not the whole story when it comes to understanding how our kidneys are handling blood flow. So there's another concept we need to explore, and that is renal plasma flow.
Renal plasma flow.
Yeah.
Yeah.
So renal plasma flow tells us how much blood plasma is flowing through the kidneys per minute. It gives us a sense of the overall blood supply to these vital organs. And to measure it, we use a slightly different approach than with GFR. So instead of inulin or creatinine, we use a substance called para-amino-hippuric acid, or PAH short.
PAHA. Got it.
Yeah.
Okay, so how is PHA different from inulin or creatinine? What makes it the go-to for measuring renal plasma flow?
Well, like inulin, PAHA is freely filtered by the glomerulus, but here's the key difference. Almost all of the PHA that doesn't get filtered ends up being secreted by those tubules into the urine.
Oh.
So by measuring the amount of PHA in both the blood and urine,
Okay.
we can get a really accurate estimate of that total plasma flow through the kidneys.
Okay, so PHA is like tagging along for the entire ride.
Exactly.
It's giving us a more comprehensive view of the blood flow.
Precisely. And when we measure PAHA clearance, we get a value called effective renal plasma flow, or ERPF, which is typically around 650 milliliters per minute.
Okay, ERPF.
Right.
So what does knowing the ERPF actually tell us about kidney health?
So ERPF is a valuable piece of the puzzle because it helps us understand how much plasma is actually reaching those nephrons to be filtered.
Right.
It gives us a broader perspective on kidney function, beyond just the filtration rate itself.
So we've got GFR, which is telling us how much blood is being filtered, and then we've got ERPF, which is telling us how much plasma is actually making it to the filtration party.
Right. Exactly.
Okay, I'm starting to see how these pieces fit together.
And by combining these measurements, we can even calculate the total renal blood flow, which considers both the plasma and the red blood cells. So it's like, getting a full traffic report for our kidneys.
This is fascinating stuff.
Yeah.
We've gone from picturing a simple sieve to like unraveling this complex network of filters and pressures and feedback loops.
Yeah. Yeah, it's quite remarkable, but there's so much more to explore in this really fascinating world of renal physiology. But for now, we'll have to take a short break. Let all this information sink in a bit.
That's a good idea.
Yeah.
We've covered a lot of ground in this first part of our deep dive. We've learned about the amazing filtration process, how our bodies meticulously control that GFR, and how doctors actually measure kidney function in a clinical setting.
It's been quite a journey so far.
It really has.
And when we come back, we'll continue our exploration and we'll delve even deeper into the intricacies of those tubules and how they fine-tune the composition of that filtrate, ultimately leading to the formation of urine.
Okay. I am hooked. See you in part 2.
Welcome back to our kidney adventure. I'm still trying to wrap my head around those numbers we talked about in part 1. Like, it's just mind-blowing how much blood those tiny nephrons filter every minute.
Yeah, it really highlights the kidney's nonstop work ethic, doesn't it? And that 125 milliliters per minute for GFR, that's just the beginning of the story. Remember, we also talked about renal plasma flow being much higher, around 650 milliliters per minute? Right. Right. And that difference between those two numbers, like the GFR and the renal plasma flow, is that where things start to get really interesting? Like, what's the significance of that gap?
That gap leads us to the concept of filtration fraction.
Okay.
So it tells us what percentage of the plasma flowing through the kidneys is actually being filtered. It's like a measure of how much of that incoming blood is actually being processed for cleaning.
Okay, so it's all about efficiency. So are we talking like 50%, 75%? What's a normal filtration fraction?
It might surprise you, but a normal filtration fraction is typically only around 20%.
20%.
20%. So for every 100 milliliters of plasma passing through the kidneys, only about 20 milliliters are filtered out to begin that journey of becoming urine.
Wow, 20%. That seems surprisingly low. Why not filter more? Would it be better to, like, clean as much blood as possible?
Well, it's tempting to think that way, but remember the kidneys aren't just a waste disposal system. They're master regulators, so they're constantly fine-tuning the composition of our blood and keeping our internal environment in balance.
Right. It's not just about, like, getting rid of the bad stuff, but it's also about holding on to those essential nutrients and electrolytes.
Exactly. Yeah, and to do that, the kidneys need to strike this really delicate balance between filtration and reabsorption.
Okay.
So a lot of what gets filtered out in that primary urine is actually reclaimed by the body as the filtrate travels through those winding tubules.
So it's like a two-step process. Filter everything out and then, like, carefully pick and choose what to reabsorb back into the bloodstream.
That's a great way to think about it. And those tubules, that's where the real magic happens.
Okay.
They're like microscopic conveyor belts, constantly moving substances back and forth between the filtrate and the bloodstream.
Okay, so I'm picturing these tiny conveyor belts.
Right.
What are they using to move all this stuff around? Like tiny forklift trucks?
Not quite. They have a whole arsenal of transport mechanisms, both active and passive.
Okay.
So active transport, that's like those forklift trucks.
Yeah.
You know, it uses energy to move substances against their concentration gradient. So from an area of low concentration to an area of high concentration.
So active transport is like swimming upstream.
Exactly.
Takes effort.
Yeah. And it's essential for moving vital substances like glucose and sodium back into the bloodstream, even if their concentration is already higher there.
Right, right. You wouldn't want to be losing your your energy source or messing up your electrolyte balance.
Exactly. Now, passive transport, that's a bit more laid back, doesn't require energy, and it allows substances to move down their concentration gradient. So, from high to low concentration. Think of it as floating downstream.
Okay, effortless transport. So what kinds of things are moving passively in the tubules?
Water's a great example.
Okay.
So as sodium and other solutes are actively reabsorbed, they create this osmotic gradient that draws water back into the bloodstream passively. It's like water following the crowd.
Passive transport, all about following the flow.
Exactly, yeah. And these active and passive transport systems work together to meticulously fine-tune the composition of that filtrate as it makes its way through the tubules.
This is an amazing process. It's like the tubules are running this like complex sorting operation, making sure that the good stuff stays and the waste gets tossed.
And it's not just about sorting. So the tubules also play a vital role in regulating the body's pH balance.
Oh, wow.
So they do this by secreting hydrogen ions and reabsorbing bicarbonate. It's like they're constantly checking and adjusting the body's internal chemistry set.
So multifaceted operation going on here.
Right.
Okay, so we talked about glucose, sodium, water. What about other things like potassium? Or, those waste products that we need to get rid of.
So potassium is particularly interesting because it's both reabsorbed and secreted in different parts of the tubules, depending on the body's needs.
Potassium, the flip-flopper.
Right, exactly. It's all about maintaining that delicate potassium balance, which is, crucial for nerve and muscle function.
Right, right. And what about the waste products? Those are getting the boot, right?
For the most part, yes.
Okay.
Creatinine, for example, is almost entirely excreted in the urine. And that's, one of the reasons it's such a good marker for estimating GFR. But urea, another common waste product, that one can be a bit trickier. So while most of it gets excreted, a small amount can actually be reabsorbed.
Wait, reabsorbed. Why would the body reabsorb urea?
It's actually it's a clever mechanism for concentrating urine and conserving water.
Mhm.
So urea helps to create this osmotic gradient in the inner part of the kidney, and that draws water out of the collecting ducts. Those are the final tubes where urine is concentrated before it's excreted.
So even waste products can have a role to play in the grand scheme of things.
Yeah, exactly. It's all about efficiency and balance. And here's another layer of complexity. The tubules aren't just, blindly following a set script.
Yeah, but
They can actually respond to hormonal signals to adjust their reabsorption and secretion rates.
hormonal signals. So it's like the endocrine system is getting in on the kidney action.
Exactly. Yeah, so hormones like aldosterone and antidiuretic hormone, or ADH,
Oh,
they can influence how the tubules handle sodium and water.
aldosterone and ADH.
Yeah.
Okay. What do those do exactly?
So aldosterone, think of that as the sodium saver.
Okay.
It's produced by the adrenal glands, and when it's released, it tells the tubules to reabsorb more sodium, and there, in turn, pulls more water back into the bloodstream.
So it's like a tag team effort to increase blood volume and boost blood pressure.
You got it.
Okay.
Now, ADH, that's like the water conservation officer.
All right.
It's made in the hypothalamus and released by the pituitary gland. And when ADH levels rise, it tells the tubules to reabsorb more water, making our urine more concentrated.
So that's why when we're dehydrated, ADH steps in to help us hold on to those precious fluids.
Precisely. So these hormones are really key players in helping the kidneys maintain that fluid balance and keep our blood pressure stable, especially when our bodies are under stress, like during exercise or dehydration.
It's amazing how all these systems are interconnected. They're all working together to keep us in balance. We've got the filtration happening in the glomerulus, the intricate sorting and reabsorption in the tubules, and now this hormonal symphony influencing everything.
It really is a testament to the complexity and the elegance of our bodies.
Yeah.
And we've only just scratched the surface. There are so many other fascinating mechanisms at play in these incredible organs.
I know. I'm already ready to learn more. Yeah. But I'm also starting to see how this knowledge, could apply to real world situations. Like, remember that hypothetical patient you mentioned last time?
Yeah.
The one with the fatigue, the swelling, and the high blood pressure.
I do. I'm glad you brought them up, because understanding the normal physiology of the kidneys, it's essential for figuring out what might be going wrong when someone experiences those kinds of symptoms.
Right. Like, now I'm thinking, could those symptoms be related to problems with filtration or reabsorption? Or maybe even hormonal imbalances?
That's exactly the kind of thinking we need to do, and that's precisely what we'll delve into in the final part of our deep dive.
Okay.
We'll put on our detective hats and explore some of the diagnostic tools and considerations that nephrologists use to unravel the mysteries of kidney health.
Okay, I'm ready to channel my inner nephrologist. Bring on part 3. Welcome back to the deep dive. We have been on this incredible journey through the kidneys, exploring everything from those microscopic filters to the hormones that keep things running smoothly.
Yeah, it's been quite a tour, and I'm particularly excited about this last part because we get to apply what we've learned. Put on our diagnostic thinking caps.
Right. Last time you left us hanging with that hypothetical patient experiencing the fatigue, the swelling, and the high blood pressure.
Yeah.
Those are some pretty common symptoms. I imagine they could point to a variety of issues.
Yes, exactly. As a nephrologist, those symptoms, those definitely raise a red flag, but they don't tell the whole story, right? It's like hearing a few notes of a song, you know? You get a sense of the melody,
Right.
but you need more context
Yeah.
to identify the tune.
So how do you start piecing together the full picture when a patient comes in with those kinds of concerns?
So the first step is, a good old-fashioned conversation. We take a really detailed medical history. So asking about their lifestyle, any existing health conditions, medications they're taking.
Hmm.
Is there any family history of kidney problems? It's all about, gathering clues.
So it's like detective work,
Oh,
trying to connect the dots between, their symptoms and their overall health.
precisely. Yeah. And then we move on to some key diagnostic tests.
Okay.
So one of the first things we check is their blood pressure.
Okay.
Because, high blood pressure or hypertension, that can both cause and be a result of kidney problems.
Right.
It's a bit of a chicken or the egg situation.
Yeah, yeah, okay. So blood pressure is a vital clue. What else should you be looking for in those initial tests?
A urinalysis is a must.
Urinalysis, okay.
It sounds simple, but it can tell us so much about how the kidneys are functioning. So we'd be looking for, things like protein or blood in the urine, which shouldn't be there normally.
Yeah, because, we learned that, those glomeruli are supposed to be keeping protein out of the filtrate.
Exactly.
If it's showing up in the urine, something's not right.
Exactly, yeah. So protein in the urine, also called proteinuria, that can be a sign of damage to the glomeruli,
Oh,
those tiny filters. And then blood in the urine or hematuria could indicate, an infection, inflammation, or even kidney stones.
so even like a seemingly basic, urine test can provide a wealth of information.
Absolutely, yeah. It's a really powerful tool for getting a glimpse into what's happening inside those kidneys.
Wow.
And then to get a more precise measurement of kidney function, we would order a blood test to check their creatinine levels.
The creatinine.
Creatinine, that's that waste product from our muscles that we talked about. You got it.
Okay.
And because it's constantly being produced and filtered out by the kidneys, it's a really good indicator of how efficiently they're working. So if creatinine levels are higher than normal, that suggests the kidneys aren't clearing those waste products as effectively as they should.
Okay, so high creatinine levels are like a warning sign that the kidneys might be struggling.
Exactly, yeah. And using the creatinine levels along with, the patient's age, sex, and other factors, we can actually calculate their estimated glomerular filtration rate, or EGFR.
That magic EGFR number.
That's the one. It gives us a numerical snapshot of how well the kidneys are filtering.
Right.
So a lower EGFR indicates, impaired kidney function. And depending on how low it is, we can actually classify their condition as one of the stages of chronic kidney disease, or CKD.
So CKD is like a spectrum of kidney health.
Yeah.
With different stages reflecting different levels of damage.
Precisely, yeah. And knowing the stage of CKD, that helps us understand the severity of the problem and then tailor the treatment plan accordingly. It's a bit like assessing the extent of a fire. Knowing whether it's a small campfire or a raging inferno, that helps firefighters determine the best course of action.
So it's not just about diagnosing the problem, but it's also about understanding how advanced it is.
Right.
So you can develop the most effective approach.
Exactly. Yeah. And sometimes we might need to do, additional imaging tests like an ultrasound or a CT scan to get a clearer picture of, the kidneys and rule out any structural abnormalities.
So it's like putting together a puzzle,
Mm-hmm.
using all those pieces of information to figure out what's going on.
That's a great analogy. Yeah. And once we've got a good understanding of the problem, then we can develop a personalized treatment plan. So this might involve lifestyle modifications like, dietary changes, managing blood pressure, or quitting smoking.
Right. And those lifestyle changes can have a big impact on, overall health. But what if, the damage is more severe?
So in those cases, we might need to use medications to help control blood pressure, protect the kidneys from further damage, or even replace kidney function if necessary through dialysis or transplantation.
Wow. Okay. So the treatment really depends on the individual
Yeah.
and the specific challenges they're facing.
Absolutely. It's all about, finding the best approach to slow down the progression of kidney disease, prevent complications, and improve the patient's quality of life.
This has been an incredible journey.
Uh-huh.
We've gone from, those tiny nephrons all the way to the big picture of kidney health. I feel like I could teach a class on this now.
And that's the beauty of learning, isn't it?
Yeah.
We start with curiosity, we dive deep into the details, and we come out with this whole new level of understanding and appreciation.
Absolutely. So as we wrap up this deep dive, is there like one key takeaway you'd like our listeners to remember about their kidneys?
I think, the most important message is that our kidneys are precious. They're often underappreciated.
Uh-huh.
They work tirelessly behind the scenes to keep us healthy. So let's show them some love.
I'm all for that.
Yeah.
How can we best support our kidneys and keep them functioning optimally?
It's all about making, healthy choices. So stay hydrated, eat a balanced diet, manage your blood pressure, get regular exercise, and don't hesitate to talk to your doctor if you have any concerns.
Great advice. Prevention is always better than cure, especially when it comes to our kidneys.
Exactly. And remember, knowledge is power. The more we understand about our bodies, the better equipped we are to make informed decisions about our health.
Absolutely. So to all our listeners out there, keep exploring, keep learning, and keep those kidneys happy and healthy. Until next time, happy diving.